Vitamin D plays a crucial role in our overall health, impacting everything from bone strength to immune function. But surprisingly, many people around the world remain deficient in this vital nutrient without realizing it. In this video, we're going to dive into the 10 key signs that might indicate a vitamin D deficiency, and why it's so essential to address these warning signs early. Have you been feeling constantly tired, even after getting a full night's sleep? One of the most common signs of vitamin D deficiency is persistent fatigue. This isn't just the typical tiredness you might feel after a long day. It's the kind that leaves you feeling drained and struggling to get through your day-to-day activities. Studies have shown that low levels of vitamin D can disrupt your body's energy production, leaving you feeling lethargic and less capable of facing the challenges ahead. Another telltale sign of vitamin D deficiency is bone pain and muscle weakness. Vitamin D is essential for calcium absorption, which is critical for bone health. Without it, bones can become thin, brittle, or misshapen, leading to conditions like osteomalacia in adults. If you've noticed more frequent aches in your bones or a subtle, persistent pain in your lower back, it could be your body's way of signaling that it needs more vitamin D. You might also find yourself getting sick more often. Vitamin D is a powerful supporter of the immune system, playing a significant role in warding off illnesses. Low levels of vitamin D can compromise your immune response, making you more susceptible to colds, the flu, or other infections. If it seems like every little virus makes you its next victim, it might be time to check your vitamin D levels. Next, let's talk about mood. Did you know that vitamin D can affect your mental health? Research has linked low levels of vitamin D to an increased risk of depression. The vitamin acts as a modulator of neurotransmitters and inflammation, which are both linked to mood regulation. People who are deficient might feel persistently down, anxious, or even show signs of major depressive disorder. If you're experiencing unexplained mood swings or a general sense of melancholy, it could be more than just a rough patch. It might be your body hinting at a deficiency. Hair loss is another surprising indicator of low vitamin D levels. While there are various factors that contribute to hair thinning, such as stress and genetics, a lack of vitamin D has been linked to alopecia areata, an autoimmune condition that results in severe hair loss. This nutrient plays a part in the creation of new hair follicles, so a deficiency could lead to premature hair thinning or loss. Now, let's move on to another symptom that can be quite frustrating: slow wound healing. If you've noticed that cuts or scrapes are taking longer than usual to heal, a lack of vitamin D might be to blame. Vitamin D promotes the production of compounds that are crucial for forming new skin. Without enough of it, your body struggles to repair damage, which could be an issue for those recovering from surgery or dealing with chronic injuries. Another sign that's less discussed, but equally important, is muscle pain. Chronic muscle pain can sometimes be linked to insufficient levels of vitamin D. This type of discomfort can range from mild to severe and might be accompanied by muscle cramps. Vitamin D receptors are found in nerve cells called nociceptors, which sense pain. When your body lacks vitamin D, these receptors may not work effectively, resulting in persistent pain that doesn't seem to have an obvious cause. If you experience frequent bone fractures, this could be a red flag as well. Even if you think you're getting enough calcium through your diet, without vitamin D, your body won't effectively absorb it. This combination can make your bones fragile and more prone to breaking. Whether you're young or old, experiencing fractures from minor incidents should not be taken lightly and warrants a check of your vitamin D levels. Let's also touch on muscle weakness, which can sometimes be subtle and develop over time. You might notice that you're no longer able to lift weights you once did at the gym, or that you feel shaky when carrying groceries. This isn't just a sign of getting older. It could be your muscles signaling that they're not receiving enough support from vitamin D. Lastly, high blood pressure has been associated with vitamin D deficiency. While there are many factors that contribute to hypertension, studies suggest that low levels of vitamin D can impact heart health. It's thought that vitamin D plays a part in regulating blood pressure through its effect on calcium balance and vascular health. If you've been diagnosed with high blood pressure and are struggling to manage it, So, what can you do if you suspect you have a vitamin D deficiency? First, make an appointment with your healthcare provider to check your levels. A simple blood test can reveal if you're deficient. Depending on your results, they may recommend dietary changes, supplements, or increased sunlight exposure. Foods like fatty fish, fortified dairy products, and egg yolks are good sources of vitamin D. But in many cases, supplementation might be necessary to get your levels up to par. Thanks for watching. Remember, small changes lead to big results over time. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell so you never miss our new content. Let us know in the comments what tip you're starting with or any questions you have.